Testosterone replacement therapy is one of the very popular treatment nowadays, and there are so many misconceptions around testosterone replacement therapy. The most common one is testosterone replacement therapy is going to make me look like a bodybuilder, or I'm going to get big like a bodybuilder. It doesn't work that way. When you start TRT and when a medical provider is monitoring, we try to keep your level in a physiological range. We'll optimize your level, but we make sure that it's in the physiological range. Bodybuilders, when they take testosterone, they take supraphysiological level of testosterone, which is not healthy. Along with the very high level of testosterone, there is a lot involved in getting that big, including some performance enhancing drugs, heavy weightlifting, very strict diet. So when you take TRT in a physiological range and try to optimize your level to improve your overall health, is not going to make you look like a bodybuilder. Yes, you will gain some lean muscle mass, you will lose some fat, and you will improve your overall health, but you're not going to look like a bodybuilder. Plus, when you start a TRT with a medical provider, we make sure that we regularly do your blood work. We make sure that your testosterone levels are in the normal range, your estrogen is in check, and all other labs are in check to make sure that you are overall in a healthy range. So TRT is going to improve a lot of your symptoms, but it's not going to make you look like a bodybuilder. If you have more questions, comment below.